President Obama is calling for both parties to work together to reduce the budget deficit. Steve Bell knows what it's like to be in the middle of negotiations like this. He was staff director for the Senate Budget Committee. He also worked for Republican Senator Peter Domenici for 25 years. He is now the senior director of the Economic Policy Project at the Bipartisan Policy Center. Steve, thanks for joining us this morning. There's a lot of moving parts to this discussion. Of course, there's deficit reduction, there's taxation, there's lowering the debt ceiling, entitlement programs. What is going to come to the table first, and what we have to assume is going to be horse trading?
Well, there will be a lot of horse trading. I think the first thing that comes is, what does the president say Wednesday? Now, over the weekend, some of his advisors said he's going to make a major speech. I don't know what that means. The question will be, will he say he's willing to change fundamentally Medicare, Medicaid, Social Security? Now, we know he's going to call for tax increases on people making more than $200,000 a year. And a lot of horse trading will go into the tax question. But the most important thing now, it seems to me, in light of what Paul Ryan, the House Budget Committee chairman, has done in his recommendations on Medicare and Medicaid, is to have the president get on board and bring at least a majority of his party along with him.
So in other words, it's the entitlement programs that have to be tackled first: Medicare, Medicaid, obviously larger parts than even Social Security.
I think Jim Lockhart, who was on earlier in the show, is right. Social Security is really pretty easy to solve. What you want is 75-year solvency there, and there's some pretty easy ways to get that done with no harm to present beneficiaries. You can't say the same thing about Medicare and Medicaid. They are much more difficult to solve, they are growing much more rapidly, and they are much more expensive over the next 20 to 30 years.
Steve, you've been in Washington for a while, as we alluded to. I mean, you've been in the middle of conversations like this. How contentious is this week going to be versus other conversations, other negotiations you've seen in the past?
This week won't be bad, because I think it's going to give a chance to everyone to see, is the president going to lead? There's been some criticism that he missed a chance in the State of the Union, and some criticism that he wasn't as active until late on these recent negotiations. So I think you'll hear a lot of rhetoric, not much negotiation. The most important question is this: has the president coordinated any of this with the so-called Gang of Six in the Senate? 3 Republicans and 3 Democrats who are trying to put together a bipartisan long-term plan that will cut $6 to $8 trillion out of debt over the next 10 to 15 years.
Steve, why didn't this happen last year when Democrats were actually running Congress with a Democratic president?
Well, let's be honest. They decided the most important thing was to handle and spend a lot of time on health care. So if you're increasing health care coverage, it's very difficult at the same time to decrease anticipated health care spending. It just doesn't. I think most people would agree now that was a mistake on the part of the president to put so much into health care reform and not as much into job creation and deficit reduction. But that's the choice they made.
Steve, we thank you so much. Steve Bell joining us there. He is the Bipartisan Policy Center Senior Director. He just joined us there from Washington, D.C.